Back of house here you have a separate building which is your outpatient clinics, which is physically disconnected from this sterile area. Separate building here, again we have the trauma building with 6 ORs and its ICU beds around it. The idea is patients will arrive in this area, into prep area, then into theatres, and then either up to the wards for recovery or into ICU, CCU if it's required. If they clear from ICU, they'll step down and go back up to the wards. Can we go to the next one?
I have a question. Is there any operation rooms in the clinic?
No, there are no operation rooms in the clinic. There are treatment rooms, plaster rooms and general stuff like that. But an outpatient clinic is not a critical care facility. People walk in, people walk out. You're not expecting to look at very sterile conditions there. You only have those very sterile conditions in your ORs. The next level up is dedicated basically to obs and gynae. We have here the labour and delivery wards, we have the NICU, the neonatal intensive care unit, we have the neonatal unit itself, and we have the IVF here. These again connect horizontally across to paediatric and obstetric ICUs. So this whole level here is dealing with the babies, which is one of the larger businesses in Kuwait at the moment. Okay. Separately again, your clinic is over here, still growing up, and over in the trauma, this is now a floor just dedicated to ICU for step down in the critical care people. At the back of that, you have what we call shared support. Now, when we move up to the 3rd floor, we are now abandoning the diagnostic and treatment area. We're now into the ward units only. Okay, so we see here now, one tower has been kept of obstetrics, but over here, the hospital administration will decide whether it's a male surgical ward or a female medical ward or whatever. These wards will change in function as the profile of your patients change in that hospital. The wards are identical in function and they can be swapped around either way. They also contain positive isolation rooms, negative isolation rooms, so that you can in fact treat the various problems that you will have. As you move up the building, you will see the same thing happening on the 4th floor, 5th floor, etc. One thing which has come in here is in the trauma building, we have created a separate rehabilitation centre completely independent from the general physical medicine that goes on. The reason is simple. If you are born without a right hand, you get used to not having a right hand. If you have a car accident at the age of 30 and you lose your right hand, you have to retrain yourself completely for the loss of the hand. So in the trauma area, we have here a separate rehabilitation centre which is designed to teach the trauma recovery the way they have to adapt to their new lifestyle. If they've got an arm missing, a leg missing or something. And there's a very nice American concept called Easy Street, where in this area we will put an old motor car, we will put an ATM, we will put a few other things so that people can have the privacy of practicing out of the wheelchair into the car, or how to use an ATM with a hand they haven't used for some time. So it's a private area to allow rehabilitation. Around here we keep going up 4th, 5th, 6th and 7th floors of these basically shared ward units, which will either be medical or surgical, either male or female, depending on your profile. And then at the top, we have a lovely Middle Eastern thing. We have the VVIP suites, one Amiri suite, 2 head of state suites, and we have 6 VIP suites at this end as well. That brings you right up to the top of the building. The basement, perhaps, is a little bit of an interesting thing because although it's a very modern place, lots of things, we have here an inpatient pharmacy with 3 months supply of drugs for the whole hospital. We have in here the general stores which carry 4 months supply for the whole of the hospital itself. And over here, kitchens, catering for obviously all the inpatients, all the doctors, all the nurses. Medical records, although, as Aziz said, we're trying to build the project with zero paper, the Ministry of Health doesn't like zero paper. You have to have medical records. So we have a huge space here to store the 1 million medical records, both electronically and physically on bits of paper. And then over here, the CSSD, central sterile, where in fact huge throughput each day, bed linen coming down, hospital equipment coming down, operating theatre equipment coming down, being cleaned, being sterilised, being repacked, dated and stored and sent back. And then over here, biomedical backup, getting the beds and everything else sorted out for you. And that is the basement area. In addition to that, a laundry and a mortuary, which are inevitable in a hospital of this size. And I think that is the concept. The concept clear: horizontal movement of patients, minimum as possible, vertical movement for non-critical people. That was the concept that was designed in Los Angeles.
Can you talk to us about the dental center? I don't have pictures for
what?
Dental center.
Dental center. Dental center consists of 2 buildings in one building. A dental casualty, which operates 24 hours a day, and then the other side operating on normal dental hours, 7 till 2, 80 chairs, a large dental centre to cater for the population around the South Surrey area. In addition to that, because it will be looking for school children, there is a children's clinic in there as well, with buses and no doubt the children will be brought from the schools for routine dental examination as part of the process. Underneath that, there are 2 atomic shelters for the staff in the hospital should there be problems at later time, C4 shelters. That building is separate, the same as you have a separate building at the top, which is staff residency for visiting staff, people like that. You saw some of Abdulaziz's slides. 2 or 3 of the theatres are equipped for telemedicine. You also have in Ministry of Health here visiting clinicians, visiting surgeons coming in to train and to teach people here, and so they will probably be staying in those residencies, and they'll be using those telemedicine equipped theatres to actually link with their teaching people either in the States or Europe, so you can get good skills in here for yourselves.
I have one more question. If the patient in casualty, the dental casualty, needs to be like inpatient, do they have room separate in the building, or should he transfer to the main building?
If you have a serious dental problem that requires a patient to become an inpatient, they will be transferred to the hospital and they will go up to one of the surgical wards. There is no residential or no inpatient care within the dental building itself. I'm very old, I can't hear you, sorry.
Are there any rules for the employment of any position? Any different employment?
Well, that's unfortunately a Ministry of Health question. But it's very simple. This hospital needs 1,500 doctors for one shift. It needs 3,000 nurses for one shift. Okay? So believe it or not, I think all of you have got a job, providing you graduate, and at least another 1,300 of you. You know, it's a huge, huge medical load. I believe the Ministry of Health are now starting their planning, because obviously they're not going to open this hospital in one day. It will take maybe 1 year to build up from 100 bed, 300 bed, 600 bed, 900 bed, 1,000 bed before they get there. So basically, I think there's a lot of opportunity. There's certainly a lot of opportunity for people who want to get involved in trauma, because there are very few trauma people around in the Middle East at the moment. It's a fairly new idea. And certainly it's a general hospital, so you'll be exposed to the whole range of medical conditions. It is not going to be a cancer specialist, it's not going to be a kidney specialist, it is a general hospital. So there will be a broad spectrum of skills required by Ministry of Health to equip the building. I hope that answers the question. I don't know how they're going to recruit it though. This is a secret in Ministry of Health. I have no idea if it's true.
There's a question.
Yes, ma'am.
Yeah, this hospital is specific for the government or for weight population?
It is being built by the Ministry of Health as a general hospital. So that means that the people who live in the area, the catchment area of South Surrey, will have access to it. In the same way that people in Jabriya have access to this hospital here, because this is their area as well.
هو راح يخدم 600,000 نسمة بحدود المنطقة، فعندهم راح يحددون بعدين وزارة الصحة منو أي مناطق اللي داخلة
I mean, as you might be aware, the Ministry of Health is expanding all the other hospitals. It's adding 300 and 400 beds to Razi, Adan, even Mubarak here. They've got plans in process. The problem is, at the moment in Kuwait, the population has gone very big, very quickly. I mean, I came here in 1979, and the population was, I think, 400, 500,000. Now we're 3 million. We need more beds, and this is part of the expansion. There are other hospitals planned as well. There are 7 more hospitals in the Ministry of Health being discussed that will go to consultants for design over the next 3 or 4 years, and then will come online over the next 10 years. There is a long, comprehensive plan by Ministry of Health to uplift the number of hospital beds, the number of doctors, the number of nurses, up to much higher standards than we have now, because the population is expanding. And I believe by 2020 or 2030, we'll be up to 5 million people in the state of Kuwait, which means an awful lot more beds are required. And I'm sorry my Arabic is not good enough to teach you. Anyway. Anything else? شكرا.
يعطيكم العافية.